As technology transforms all fields, experts say healthcare must not be excluded as digital health has the potential to reshape every step of healthcare delivery, including maternal health. This is our focus today on Sound Health. I am Olasumbo Modupe. Thanks for joining us this evening. We begin with COVID-19 updates.
The World Health Organization says more than anything else, the COVID-19 pandemic has demonstrated that health is not a luxury item or simply an outcome of development. It is a human right and a prerequisite for social and economic development and stability. Director General Tedros Ghebreyesus added that while the pandemic is still ongoing, government must focus on three priority areas. First is vaccine equity, and that means sharing vaccines now and also investing in local production. Ghebreyesus explained that if countries immediately share doses with COVAX and if manufacturers prioritize COVAX orders, at least 10% of the population of every country will be vaccinated by September and at least 40% by the end of the year. Dose sharing must happen immediately to fill an urgent supply gap with an additional 250 million doses by September, with 100 million in June and July. Key players also need the sharing of know-how, technology and licenses, and the waiving of intellectual property rights. Hence, Africa should support the waiver of intellectual property rights. He charged the continent to build that capacity through local and regional manufacturing, not only for COVID-19 vaccines, but other vaccines and medical products. Ghebreyesus added that vaccines alone will not end this pandemic. Hence, prevention must be embraced, and same public health measures that have been the bedrock of the continental strategy must remain central to the response. That means strengthened surveillance, increased testing, careful contact tracing, supported quarantine, and compassionate care. And it means empowering and engaging communities to continue with the individual precautions that we know work: physical distancing, avoiding crowds, wearing masks, cleaning hands, and opening windows. Countries must also embrace preparedness and equally learn the lessons the pandemic is teaching us and do everything to prepare for, prevent, detect, and respond rapidly to future epidemics and pandemics. The federal government has added South Africa to the existing list of countries where inbound non-Nigerian passengers are temporarily banned from entering the country. Rwanda, Zambia, Namibia, and Uganda have also been put on the watch list. Nigerian passengers from there are also expected to fulfill some stringent conditions before they are allowed into the country. The announcement, which was made by the chairman of the Presidential Steering Committee, PSC, on COVID-19, Boss Mustafa, was in response to the spike in COVID-19 cases in the African country and the prevalence of variants of concern in South Africa and the dangers associated with importation of such virulent strains.
It is still Sound Health on Lagos Television. Now, joining us via Zoom from Lagos this evening is Ayo Adebusoye. He is the chairman, Public Health Sustainable Advocacy Initiative. Welcome to the program.
Good evening. Good evening.
Now, before we look at how technologies can transform the health sector, especially maternal health, what is your overview of maternal and health care in Nigeria?
Well, it's clear that there are a lot of challenges in Nigeria. The maternal mortality rate is one of the highest in the world, 512 maternal mortalities for every 100,000, one of the highest in the world. Our out-of-pocket expenses, also one of the highest in the world. About 70% of our health spend is out of pocket, and that is completely below the standard because that is a sure guarantee for increasing poverty whenever there is any illness and for denying access to quality healthcare in time. So our indicators, of course, our child mortality also one of the highest in the world. So we really are in a situation where, as our the chief of staff mentioned during the last year when the COVID pandemic was so intense that he did not know how poor our health infrastructure was, which is what we've been shouting about for decades, so to speak. So our health systems in the country really needs a lot of revamping, and all hands need to be on deck for that.
Experts are advocating creative technological solutions for maternal care. How can technology potentially transform the field of maternal and newborn care?
Well, it's clear that even with the COVID, we can see how technology has even played such a very, very powerful role in ensuring that we can get vaccines rolled out within a record time. So for maternal and child care and healthcare generally, there's been a lot of interventions which are so timely. Lagos State actually went forward with the eco-telemed last year during the COVID lockdown, where people could hardly go out and access facilities. And so that was introduced, and Lagos State really ensured that they even backed it up by ensuring that it was free for the first few months. And of course now it's integrated as part of the Lagos State Health Insurance Scheme. So the eco-telemed is a very, very innovative deployment of technology where the patients can phone in and get medical health professionals to counsel them, ensure that they don't have to come to the facility initially just for the initial counseling, refer them to where they can get specialized treatment and take it from there. So that is one aspect. We also have various apps that are coming out lately. We have the Omami app, which is one which brings out the various patient experiences and the healthcare. We have the MDoc, where you have various online directories where people can actually get knowledge of where to access care. And this is very, very important because one of the challenges people face is not knowing where to go in case of a health emergency or even health treatment, or when you want to specialize medical care, maternal care, or child care. So those are we also have the Mom Care, which is a platform which tracks the whole, I think it's Farm Access Foundation that did this, and which tracks the whole journey of our expectant mothers to ensure that they can actually get data and be able to ensure that proper funding, proper treatment is taken at the appropriate time. So there are various initiatives that are already coming up. And even right now, our HMIS, Health Management Information System, which Lagos is using to get data, and of course, at the national level, is key. These are all things that are very, very important. Also, I know Lagos was trying to ensure that they deploy a platform where all the health professionals in the state are on a particular platform, so that people will know where everybody is, how many health professionals we have, how many nurses, how many midwives, doctors, so that we have a lot of human resource shortage, especially in the health sector. So this would be one very important tool that can be deployed to ensure that we can know where all our health professionals are and we can maximize their skills. So these are a few examples.
So let's be more specific now. In what areas of the maternal and child care field are new tools and technologies most needed? Because, for instance, you mentioned some platforms earlier in your response. Let's be much more specific now. What areas are actually lacking?
The various aspects. One of it is data is also one of the real challenges we face generally in this country. So even data about where to access specialized care is also lacking. That's why this MDoc, one of the apps, one of the technology solutions, hopes to address that. And I think we need more of that, where persons can actually get those kind of data, because that is key, especially at the right time, to ensure that we can actually expectant mothers, persons who want to take care of themselves, children who need medical attention can get it fast, the information fast. And also the aspect of the platforms where you can actually be able to track a progress of every expectant mother from the beginning throughout, because things can happen at any time, and so that there will be that feedback loop very quickly with regards to what appropriate treatment is needed. Now, there are various aspects, but one of the most first aspect is even to know where to go for what, because that can be a matter of life and death. So be able to get quality information timely, that is key. Now we could see the eco-telemed aspect trying to bridge that gap initially even from last year, where at least you can have access to a health professional toll-free number, and so that would actually reduce your time and effort and issues trying to access a health professional, especially when moving around is not feasible. So we can see that data is very key. Getting data to the patient, ensuring that the patient knows where to go at the right time is key. One of the things that is coming up, especially with artificial intelligence and all, is that the technology is moving so fast where we could actually even perform a surgical operation on someone remotely, through various technologies, so that a specialist may not have to fly in or out, just like our president is flying out to England for treatment. You don't have to do that. Everything can be done remotely. And I think that's some of the things we actually need to really push. And I think it's why our universities, we need to have more endowments to ensure that we can actually do this. As I said, we should not depend and wait for foreign people to do these things. We need, because we have the population. We have huge population, and we have the need. This high maternal mortality, high child mortality, we have to address.
No doubt, for optimal impact, technologies must be applied effectively. How can we ensure that the targeted consumers at all levels, from the providers to the mothers, are able to use these technologies? We also need to consider the below the line group now, people that fall on the pocket line now.
Yeah, and in fact, in Lagos State, for instance, 70% are considered on the poverty level. So, very important. We found out that studies have shown that 83% of Nigerian women, only 83% have access to mobile technology, and only about 38% are on the internet. So, we have to also think about that and deploy use of SMS, the USSD codes, to be able to send messages timely to those who are not connected to the internet. So those are the considerations any solutions provider needs to bring on board. For instance, in Lagos State, at Lashma, they deploy everything, because they in fact, without using technology, the health insurance scheme will not work, especially for Lagos State, where we're talking about 27 billion and counting. And of course, we know that it's supposed to be mandatory. The Lagos Health Scheme law provides for health insurance to be mandatory, so it's going to be scaled up gradually to cover everyone. And the only way that will be possible is when we have our digital platforms working optimally. And I know that they're working on that to ensure that they can actually capture both the service providers, all the data of the service providers, the patients, all their own data, and ultimately we're looking at going to a situation where if you go for treatment somewhere, you have your of course, confidentiality is there, everything is in there, so that any provider, any other specialist will be able to access those data there, and everything is actually going to be in real time. We're at a dashboard, even from any service provider will be able to see what's the situation, current situation with these patients at a point in time. It's evolving, and we're going to need a lot of effort with regards to funding, resource mobilization, and this is one thing the government, both the state and federal, needs to really pump into research and development, R&D, into deploying the kind of very people-friendly solutions that will be able to be accessible to all our mothers and children and the general population to access healthcare, universal healthcare.
All right, so let's look at approach and strategy now. What would you recommend in terms of measuring success and impact now? How do we measure that no one is left behind as we utilize all these tools?
One of the main measurement indicators for our health system is how many mothers are being saved, children are being saved. Mother and child mortality is the main indicator of any health system. That is one. Two, the amount of persons who are able to access health facilities. Health facilities, skilled health professionals have access to that. That's what the universal health coverage, to ensure that everybody has access to qualitative health care at an affordable price. And this is key. So those are the indicators that we're going to be able to say, yes, our technology solutions are driving us towards. And we can then measure, there's no other measurement of success. If our mothers are dying at this rate of 512, I mean, there are some countries that have single-digit mortality rate. There are some countries that if one woman dies during labor, during pregnancy-related period, it's a big issue. It's a big thing that will bring all various a panel and everything. So we need to come to that level where not one woman will die for natural and undergoing a natural process like delivery, pregnancy and delivery. So that is the key measurement of success. How many of our mothers are being saved? How many of our children, infants, especially the infants below 5, are being saved?
Hopefully, we would conquer maternal death and child mortality in the country while we make use of or utilize information and communication technologies to improve maternal and neonatal health outcomes. So thank you so much, Mr. Ayo Adebusoye, for your time and resources today on the program.
Thank you very much.
Thank you for speaking with us, and thanks for your insights. I've been speaking with Ayo Adebusoye, the Chairman, Public Health Sustainable Advocacy Initiative on Soundhealth. Thank you so much for your time once again. Soundhealth continues with health updates. Please stay tuned. This is all we have time for today, this week on Sound Health. Join us again next week on another edition. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.